I want to bring on Dr. Daniel Griffin, ProHEALTH Infectious Diseases Chief and a national process expert for vaccine administration at the healthcare company Optum. Doctor, thanks so much for joining us today. So now that we have not one, but two vaccines that are likely to be receiving this emergency use authorization once Moderna gets that rubber stamp from the FDA, I'm wondering if that complicates distribution because the distribution for them both is a little bit different. I know that they are, as Anjali was just describing, they are going to be distributing the vaccine a little bit differently using different processes, but wondering if that makes it broadly more difficult or if it makes it a little bit easier.
No, I'm going to suggest it makes it easier, actually. I think that, there's a lot of excitement. There's a lot of buzz at work. People are referring to when they get their text or their email saying they can schedule their vaccine. They're referring to it as their golden ticket. The Pfizer vaccines really did a good job of coordinating with hospitals, making sure that those vaccines were where they could be very quickly put into the arms of people that are staffing our ERs, our ICUs, our pulmonologists, really those critical people that need to be there. Moderna is going to be working with McKesson, which is a company that we all have a relationship in healthcare, really much more in the outpatient setting. So this is going to be a vaccine that a lot of us see going out to the primary care centers. So your primary care receptionists, your nurses, your support staff, your providers, as well as the urgent care doctors. A lot of these providers that treat that 80-90% of people that don't end up in the hospital. So we are super excited, and I think this has been really well thought through, and I think there's every reason to be positive about the distribution challenges.
Doctor, when I think about the vaccine distribution, I think one of the things I think of most is wariness about the vaccine from a lot of the American people. I'm wondering how doctors or public health officials can overcome that to really encourage folks to take this vaccine, because, I mean, the vaccine is really only as good as the amount of people that actually take it.
No, that's absolutely true. And we say that about everything, every medicine we've come up with. If it sits there and doesn't actually end up either being taken by the person or the vaccine doesn't end up getting injected into a person, it's not going to protect them. One of the things we're seeing, and I refer to this as the Yelp review, it's one thing to hear the science is really good, but it's something else to see someone you trust, a physician, a nurse, a healthcare provider, get that vaccine and really endorse it with action. And that's what we're starting to see. And in all these surveys about hesitancy, the numbers of Americans that are excited about the vaccine seems to be rising very quickly. And I'm even seeing it now just in, well, it's only been about a day. And I'm already seeing sort of this excitement like, oh, you're signed up. I want to sign up. So I think that, if things continue to go the way they have, if the data and all the science and all the experience is what we've been seeing, I think, if anything, the demand for this vaccine will be higher than the demand for vaccines have ever been. So what do? We continue to communicate, we continue to be honest, and we share those experiences.
Doctor, I have about a minute left with you here. Wondering what you make of the news of lockdowns. It's a threat that we've heard, at least here in New York, especially in New York City after they shut down indoor dining. Now a warning that there could be a quote unquote pause in the city. I'm wondering if you think that is the right call to make, especially as we see the case counts continuing to rise, the death counts now crossing 300,000, hospitalizations increasing. Should we be getting a little bit more restrictive?
That's a fantastic question, and it is really tough. You look out there, and I have to say, it is worse right now in our country than it has ever been. We have more Americans in the hospital than ever. We have more Americans dying per day than ever. It is as bad as it's ever gotten. So this is really a time when people need to be careful. I know the holidays are here, Hanukkah right now, Christmas around the corner, New Year's, Kwanzaa. This is a time when people have to make smart decisions. I would much prefer if people made smart decisions instead of being forced to do those. But if we can't rein this in and the hospitals fill, and this is the way that we sort of regulate ICUs and ERs and hospitals, there are some potentially tough decisions ahead of us.
All right, Dr. Daniel Griffin, ProHEALTH Infectious Disease Chief, thanks so much for joining us today with some of that sobering news.
Thank you so much.